Okay. Well, hi, everyone. Thank you for being with us today. This is, I'll call to order our meeting of the Emergency Medical Care Advisory Board for Thursday, May 13th. It's 4 o'clock, so it's time to begin. As we move through the meeting today, just so it's been a while since we've done this, if you are making a motion, would you please give us your name so that the person who's taking minutes knows who made the motion? And if you're going to second, do the same thing. And then Jeff will probably do a roll call vote for each of the votes, won't you, Jeff?
Yes, sir.
Okay. All right, good. So without any further ado, I think we'll go ahead and start. Jeff, Mr. Ferris, can you please do a roll call as to who's present?
Yes, sir. Thank you, Mr. Chairman. Sheriff Youngblood. Sheriff,
I'm here, Jeff.
Okay, thank you. Chris Miller.
I am here.
Bruce Peters. Dr. Lyon.
Here.
John Surface.
Here.
Chairman Maggard is here. Leslie Wilmer.
Here.
And Dr. Kansen.
Here.
Have I missed anybody? We have a quorum, Mr. Chairman.
Thank you, Mr. Ferris. I appreciate that. First, we're going to deal with our consent agenda today. Consent agendas, does everybody participating have access to an agenda? Anybody not have access?
They were all sent an agenda, Mr. Chairman.
Very good, thank you. So consent items are indicated on our agenda with a CA preceding them. We're going to vote on them all at once. I'm just going to cite which ones they are. So the first is item number 5. Then under item 10, items A through H, item I under item 10 is not on consent. And I think that's it. Mr. Ferris, are there any others besides that?
No, sir, that's it.
Okay. Do any members of the public have a question or about any item that is on the consent today? Do any members of the board have a question about anything on consent? Okay, then colleagues, would somebody please give us a motion to approve the consent calendar and give us your name before you make your motion?
Youngblood, motion.
Thank you, Sheriff. Is there a second?
Miller, second.
Miller gave us a second first. Thank you. Let's see, Mr. Ferris, would you please take a roll call of the vote?
Yes, thank you, Mr. Chairman. Sheriff Youngblood is a yes. Chris Miller.
Yes.
Dr. Lyon.
Yes.
John Surface.
Yes.
Chairman Maggard.
Yes.
Leslie Wilmer.
Yes, sorry.
I distinctly saw her lips move.
I'm sorry, what was your answer, Leslie?
Yes.
Okay, thank you. And Dr. Kansen?
Yes.
All ayes, passing, sir.
Thank you very much. Next, we're going to have a subcommittee report. This is item number 6, and it's a report from Jeff Ferris on the ambulance patient offload times, the task force that we've set up. So, Jeff?
Thank you, Mr. Chairman. The task force has been formed, and it has met on 2 different occasions. It's met on March 11th and April 22nd, and all members have agreed then to meet the 3rd Thursday of each month moving forward from here. The following hospitals have submitted internal action plans to assist with APOT times. Adventist Health Bakersfield, Adventist Health Delano, Adventist Health Tehachapi, Bakersfield Heart Hospital, Bakersfield Memorial Hospital, Kern Valley Hospital, and Ridgecrest Regional. As the plans came in at the meetings, we would sit and go through them as a group so that every hospital had the opportunity to share in what the other hospitals were doing, and if necessary, they could borrow ideas to help them with their APOT times. It worked out pretty well so far. Several hospitals have implemented surge plans that activate when ambulance traffic reaches a specific level. As of now, APOT times appear to be maintaining, and I am hearing from the field that communication between hospital staff and field providers is improving, and they are working together to get patients offloaded. So that's very promising. All hospitals are engaged in the process and appear to be working on the issues. I think that so far, after 2 meetings and monitoring the offload times and hearing what I'm hearing from the field, it appears that we are making progress and moving in the right direction. Hopefully, we will be able to diminish those APOT times. That concludes my report. I recommend we receive and file, and I wanted to ask Dr. Lyon if he wanted to comment as he sits on that committee as well.
Dr. Lyon, do you have anything to say?
Yeah, I think just to echo what Jeff had indicated, I'm happy that we have been able to develop a collaborative work group to try to move this process forward, and that the hospitals and the EMS system as a whole is working together to try to resolve this problem. And I'm hopeful that we will be able to overcome this and find a permanent solution, long-term solution.
Very good. I'm delighted that the issue is moving towards some kind of resolution. It's been, an issue for a long, long time. So great job to all you that are working on the task force with us. Do any members of the public have any comment to us about the report that Mr. Farish just gave us? Okay, then let's go back to the board members, colleagues on the board. Anybody have a comment? Then is there a motion to receive and file Mr. Farish's report on the APOT task force?
Canson, motion.
Thank you. Is there a second?
Lyon, second.
Thank you very much. Mr. Farish, would you please take a roll call vote?
Yes, sir. Sheriff Youngblood.
Yes.
Chris Miller.
Yes.
Dr. Lyon is a yes. John Surface.
Yes.
Chairman Maggard.
Yes.
Leslie Wilmer.
Yes.
And Dr. Canson is a yes. That passed all ayes, sir.
Very good. Thank you, Mr. Ferris. Next up, we have public comments. We offer an opportunity for the public to discuss or to talk to us about any matter that they would like that is not otherwise on our agenda, but still has some pertinent connection to what MCAB's effort is. So are there any members of the public that would like to make comment to us this afternoon before we proceed to the next item? Mr. Ferris, are you aware of any requests to make public comment?
I am not, sir.
Okay, thank you very much. We'll close that opportunity then and move on now to under new business item number 10I, which is a release of Maddie Fund's request. I think, Mr. Ferris, you're going to tell us about that, aren't you?
Yes, sir. Thank you. Prior to March of 2020, Kern County EMS had a small warehouse which stored our emergency preparedness supplies and equipment. This space proved to be insufficient to store enough supplies to support the pandemic response. We were forced to reach out to the state to request supplies much sooner than we had anticipated after the pandemic hit Kern County. So Kern County EMS is requesting the release of Maddie funds for the purchase, or actually the lease, of warehouse space for storage of emergency preparedness supplies and equipment. Currently, the majority of our emergency preparedness supplies are being housed at the fairgrounds. The fairgrounds is a temporary location that will not be there for the existing lengthy future. And so we need to be looking to have warehousing space to store this material. As we enter what we hope is the post-COVID era, we're going to be forced to house that equipment somewhere and have it readily available in the event of another pandemic, heaven forbid, or a natural disaster or any type of disaster. The proposed warehouse has been occupied by the Elections Division of the Auditor Controller County Clerk's Office since 2011. Their agreement expired March 1st of this year. EMS will be entering into and is proposing a 5-year agreement for approximately 21,000 square feet of warehouse space. This will accommodate our current and future supply needs as we see it necessary in the event of a disaster. Additionally, this space also has an air-conditioned section that is necessary for some of our sensitive electronic equipment so that it doesn't get overheated. The requested funds are for $285,868.40, and what this is for is the first 2 years, and it includes $26,000 to cover maintenance for that time frame. The remaining 3 years of the agreement we have determined will be covered by other funding streams. So I wanted to just read the intent to release MATI funds as this board approved it, as approved by the county council as well. The intent to release MATI funds, the discretionary portion by the county, is to heighten, increase, and improve from the normal and customary base operations the delivery of pre-hospital care to the people of Kern County. This would include programs, services, training, equipment, and or learning materials that would have a high likelihood to improve the Kern County EMS system of care from its normal and customary base operations. The requested items, I feel, the service and training must benefit EMS stakeholders, especially the community at large. So the requested lease of the warehouse space for the first 2 years, I believe, meets the intended use of the discretionary MATI funds in that it will provide EMS the ability to house the necessary supplies and equipment in the event of another surge in the pandemic or another disaster should it occur, and we will have plenty of room to be able to store enough equipment to supply the entire county for a period of time. It will benefit the community at large, assuring that the necessary emergency equipment and supplies are readily available for distribution across the county. Therefore, it is recommended that the board approve this request for the release of the discretionary MATI funds. That concludes my report.
Thank you, Mr. Ferris. Let's go first to the public to see if the public has any comment, and then we'll come back to the board. Any members of the public wish to make comment to us about this request? Don't hear anyone. So one more chance. Nobody in the public wants to make a comment? Okay, let's return to the board then. Colleagues on the board, do you guys have any comment about this item, this request to use MATI funds to lease the space? Nope.
Mr. Chairman, John Surface, I move we approve.
I'm sorry, could you repeat that, please?
Yeah, John Surface, I move we approve.
Oh, thank you, Mr. Surface. Thank you, John. Is there a second?
Mr. Chairman, just so you know, this is GK County Council. I wasn't asked for a written opinion, but I concur in Mr. Ferris's assessment regarding the fund. So you have County Council's agreement with Mr. Ferris's assessment.
Okay, thank you. We had a motion by Surface and a second by Youngblood. Any other discussion before we vote? Okay, Mr. Ferris, would you please do a roll call vote?
Yes, sir. Thank you, Mr. Chairman. Sheriff Youngblood?
Yes.
Chris Miller?
Yes.
Dr. Lyon?
Yes.
John Surface?
Yes.
Chairman Maggard?
Yes.
Leslie Wilmer?
Yes.
Dr. Kansen?
Yes.
Motion passes with all ayes, sir.
Very good. Thank you very much. Thank you, colleagues, for moving forward with that approval of that. That'll be helpful for us to have that space. Next on our agenda is item number 11, which is the manager's report. Mr. Ferris, do you have a report for us today?
I do. Thank you very much, Mr. Chairman. I'm going to share my manager's report. Hopefully you're all seeing the PowerPoint.
Yes.
Okay. So the first quarter, basically, this is supposed to be our annual meeting, and a lot of the reports that you received were for 2020, and I think that we've covered 2020 pretty well in the past meeting and in the reports that you got. So I would like to start this report with the first quarter of this year. So we've seen significant changes in EMS, in the system, and in COVID in the first quarter of this year. If we look at this chart, you can see that on the 4th of January, we had a daily case count of 1,412 cases in Kern County. By February 1st, that was down to 574. And by January 1st, it was down to 161. And by the end of March, it was at 68. And it has continued to decrease or level out pretty much since then. I am going to talk about a slight spike here in a minute, but it's pretty much leveled out. Our system call volume, we saw drop greatly in February, but came back up in March. To a pretty good level. That was a little bit concerning, watching our ambulance call volumes spike like that. However, when you look at the ambulance decontamination numbers for the same months, they just continue to drop. So the call volumes that we're seeing do not appear to be linked to COVID at this time. We are attributing it to normal time of year. The weather's getting good. People are out. Lots of motor vehicle accidents, unfortunately. People are actually coming out probably sometimes for the first time in a year. So we're seeing that increased call volume. Patient offload times, you can see along with the call volume, these offload times show the same shape. So you see them decreasing in February and then increasing again in March. This is for your 1 to 2 hour offload times. In March, we had 311 incidents of that countywide. And then the 2 to 3 hours, you can see the same. Basically, it's following the same shape as the call volumes did. And then the greater than 3 hours, 27 incidents in March. Not horrific, but it is entirely too long. So the surge plan appears to have been a success. We were able to manage the increased call volume, the extended offload times, the staff illnesses, the ambulance decontaminations without having to reach out for ambulance strike teams or assistance from out of county. Now, staffing assistance was called in from the state for some of our hospitals to help them with the influx of patients during that, especially in December and January of this year, when the influx was at its worst, at its peak. In mid-January, we had 88 COVID-confirmed patients in the ICUs and 410 hospitalized COVID-confirmed patients. By mid-February, those numbers had dropped to 51 in the ICU and 228 in hospitals, and as of March, mid-March, that number was 26 in the ICUs and 92 hospitalized. So we see these numbers slowly working their way, actually not too slowly, working their way down, which is a very good thing. Our most recent data, and this is data from just a couple of days ago now, we have seen a little bit of an increase. We are paying very close attention to it. We now have 33 COVID confirmed hospitalized patients and 8 in the ICU. Now comparing that to what the numbers we just saw, that's great. But compared to a week ago when we had 17 and 4, we are paying very close attention to that and watching it and continually daily monitoring those decontaminations of ambulances. So we're not seeing an increase in that. So we're not sure these patients are walking in apparently to hospitals. We have identified 2 variances in Kern County. There are 15 cases of the B117 and 1 case of the B1351 in Kern County at this time. It's important, and I really want to emphasize that, yes, we are seeing numbers that are diminishing. That is great. We are very excited about that, but now is not the time to stop masking and social distancing, and everybody needs to get vaccinated. As of this morning, Kern County began vaccinating children 12 to 15 years old. So that's a very positive thing. And we need to get the word out to make sure that everybody gets vaccinated in order to eradicate this virus. Vaccinations, continuing EMS have been assisting in the delivery all across the county. We've assisted in administering the vaccine to SNFs, public health staff, and the Rio Tinto mine. Additionally, we have been an integral part in the vaccination clinic at the fairgrounds, providing medical supervision for the people being vaccinated out there. And we've actually subcontracted with a first responder company in town to provide EMT coverage out there as well. Our regional disaster medical health specialists are continuing to assist in Region 5 with COVID relief efforts. The priorities are to support vaccination sites within the region, as well as now they're into recovery, working with operational areas in the region to obtain and return all those durable medical pieces of equipment that were deployed by the state, things like ventilators and IV pumps. And EMSA has completed the steps to add a second full-time RDMHS. So now in our office, we have 2 full-time regional disaster medical health specialists, which is a good thing, especially during a pandemic. So in addition to COVID-19, some of the things that we have done the first quarter of this year, first we hired a new EMS coordinator, Edlyn Blankenship. She comes to us with approximately 6 years of experience in the field. She has taken over certifications and licensure, and she is working and assisting with emergency medical dispatch and stroke designation. We have upgraded and improved our emergency medical dispatch system to the most current 13.3. That is the International Academy's EMD protocol. There are huge changes occurred in this protocol. Several of them are listed here, clearly defining what obvious and expected death are. A new fast track for opioid overdoses, which is a very good thing. And then this final one is an added protocol for active assailant or active shooter in the unlikely event that the emergency medical dispatcher has to dispatch this instead of the law enforcement dispatcher. We are currently in the process of a protocol update. It should be done in actual days now. We have altered or all drug names have been converted to generic names because that's what Hand-Heavy, which is the system you all approved, goes by. So we're making sure that everything is in line with Hand-Heavy. Language was added to the determination of death policy. We're updating hospital names in our decision summary because we've had several hospital name changes. And once those protocols updates are completed, then we'll be providing an annual update class for all the field staff. The goal is to have these protocols effective July 1st, and then Hand-Heavy will be effective July 1st as well. They're currently printing up the booklets, the actual physical booklets that go along with it, with the app, and so they should be live July 1st as well. And EMS continues to meet regularly with our stakeholders. We want to ensure the successful exchange of information and to and from all of our entities out there so that everybody's up to date on the COVID situation and anything else that needs to be updated. Mr. Chairman, that concludes my report. I'm available for any questions.
Thank you. Mr. Ferris, do any members of the public have any comment about the manager's report we've just received? Okay, colleagues on the board, how about you guys? Anybody have a comment, or we'll give you a chance in a moment to mention whatever you'd like separate from this, but any comments regarding the manager's report? Okay, I'd just like to say, and I'll say it now rather than under the board member comments, I am so proud of and grateful for the extraordinary work that everybody that has been involved in trying to help us manage COVID has done, whether they be first responders, law enforcement, firefighters, nurses, techs, janitors in a hospital, anyone you can imagine, has hospital administrators, the cooperation between the hospitals, ambulance companies. It's just remarkable, the job that's been done. And I haven't seen our community come together like this in my tenure in government. It's just been a great thing to watch people dead set intending to manage this thing. So I'm grateful to everybody involved in that. So thank you, Mr. Ferris, for giving us more detail about that. Okay, is there a motion then to receive and file Mr. Ferris's manager's report?
Miller, I'll make a motion.
Thank you. Is there a
A
second?
second.
Thank you. That was Leslie. Okay, Mr. Ferris, would you please take a roll call?
Thank you, Mr. Chairman. Sheriff Youngblood,
Yes.
Chris Miller,
Yes.
Lion,
Yes.
John Surface,
Yes.
Chairman Maggard,
Yes.
Leslie Wilmer,
Yes.
and Dr. Canson.
Yes.
Motion passes with all ayes, sir.
Thank you. Okay, let's next go then to board member announcements or reports. Colleagues, is there anything you'd like to say to us today before we adjourn?
Mr. Chairman, John Surface.
Yes, John, go ahead.
Start by, pointing out that today is the fallen officers memorial has been going on, and we don't want to go throughout the day without mentioning that. And then Sunday is the beginning of National EMS Week, and we've got all kinds of educational stuff going on. And COVID last year canceled EMS Week. We can't do as much as we want, but it's still important to recognize all the first responders that are out there doing what they've been doing through this whole COVID extraordinary event that we've all worked through. So just want to make sure that we recognize all the first responders that came together to pull this thing off.
Very good. Thank you. I neglected a moment ago to thank and mention the level of cooperation and the way this board has stepped up. When the questions came to this board as to would we allow and find creative ways to respond or deal with response times, things like that, you guys stepped up exactly the same way that I hoped you would. So I'm going to congratulate you and thank you for your service on this as well. Okay, does anybody else have anything they'd like to say before we adjourn today? Okay, very good. Thank you. Our next meeting is scheduled for August 12th, 4 o'clock. We'll see between now and then whether we meet remotely or we meet in person. That we might know something more by then. The deadline to submit information to be included in that meeting is Thursday, July 29th, 5 p.m. To get it to Mr. Ferris. Okay. Anything else before we adjourn? Anybody? Thank you very much. I'm grateful for all of your help. Mr. Ferris, thank you for helping organize this meeting. And I would call for a motion to adjourn.
Moved.
Thank you very much, Dr. Kenson. So then without objection, so ordered. We'll see you guys next time. Continue to be safe out there. Bye-bye.
Thank you.